patient into a female today. First thing I want to do is provide privacy for my patient, wash my hands, introduce myself to the patient. My name's Ian. I'm going to be putting in a Foley catheter inside of you today. Can you identify your full name and your date of birth for me? I'm going to verify that information on the patient's wristband, including medical ID number. Also for this, I'm going to also need a medical order to do this procedure. Alright, so I wash my hands, provided privacy. First thing I want to do is clean the genital area. So I'll have to expose the patient. Oh, I also want to put the bed in a safe height for myself to be able to work on the patient. So I'm going to raise it up a little bit. Alright, that looks pretty good right there. Expose the patient. I'm going to make sure the patient, I'm going to try to help the patient here spread the legs out. So I have my warm water, my basin of warm water here with some soap. I'm going to put in some gloves. I have my washcloth here. Clean the outside, other side, and then clean in the middle. For clean, I'm gonna dry off, going the same way, outside, other outside, and then down the middle. Alright, so I cleaned and dried the patient's pubic area. Throw away my gloves, and then get rid of my basin here, this side, and wash my hands. Alright, so the next thing I want to do is do my Foley catheter insertion. This is a sterile procedure. So here's my package here. Make sure that it is not expired or anything like that. We just used it, so it's a little crumpled up. I could use this for my garbage. You put this at the base of my patient's bed. Open this up. So I've got one sheet on the top here that I'm going to use. I'm going to put this underneath my patient. Shiny side down and underneath the patient buttocks.
And if you did that in real life, we would just put on a new pair of
Okay,
sterile gloves.
so we have
You know
that.
what I mean?
That looks
It's not
good.
like you'd have to start
I have my sterile gloves that I will put on next. Garbage. Okay, so next thing I want to do is put my little tray to the side here. Or actually, I can put it right down here, so I'm right close to that patient. So next thing I have is I have my iodine. So I can't open this up for this demonstration, but I would be able to put this all over my cotton swabs here. So I'd be dousing, completely saturating the cotton swabs inside of here. Throw that away. Next thing I want to do is I want to start to sterilize the vagina. Take my first cotton swab, go down the side, throw this away. Take another one that's all saturated, put it on the other side, throw that away. And then my last one, I'm going to go down top to bottom and throw that away. Okay, so I just sterilize that. Next thing I want to do is I have my sterile lubricant. So I'm going to put a little bit of the lube. I'm not going to open this up in real, but I'm going to put some of the lube kind of in my little tray right here. And then once I get my catheter out, I'm going to dip the end of my catheter with a little bit of lube in there. Alright, so I use that. I'm going to throw that away. Okay, so next thing I have is my alright. End part of it came off. I'm gonna throw that away. Alright, so I'm gonna dip the end of the catheter into some of that lube. Get, the tip end nice and lubricated. I'm gonna open up the labia, the vagina, and insert my catheter. Okay, so I went in as far as I can go. Normally, I'd probably be getting some urine discharge right now. That's the way that I would know that my catheter is working properly. After that, I want to lubricate, or I want to completely fill up the ball with. So yeah, I've got 10 milliliters of liquid here. Insert all that. This is going to keep my catheter in place and not let it slide out. And I give it a little bit of a tug. Make sure that it's in there. It's definitely in there tight. It's not going anywhere. Then I want to secure my catheter so the patient doesn't accidentally pull it out. Okay, so it's on there good. Make sure the Foley isn't on the ground. Secured to the side of the bed. If I needed to, I would be getting out a urine sample from my little sterile container right there. So I'm going to take off my gloves, throw them in the garbage, and throw everything else away. At this point, I'm going to wash my hands. If there was any excess, like iodine or anything that became dirty, I could again use my sterile basin or my basin and wash the patient. Throw all my equipment away and cover up the patient. Make sure that the patient didn't have any pain at all from the catheter. As comfortable as they can be with the catheter inside of them. Whisk myself around. So I'm going to document everything that I just did. Also document how much discharge came out of the catheter insertion. Wash my hands again, and then put the patient's beds that I raised it in a safe height, all the way down to the ground. And that's it.